Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone! Today I'm going to talk to you about something you might have in your medicine cabinet right now. Hydrocortisone cream. Whether you bought it over the counter or got it prescribed, we're going to break down what you need to know about this common treatment. So what is hydrocortisone cream? Simply put, it's a topical steroid used to reduce inflammation and treat a variety of skin conditions like eczema, psoriasis, and even the occasional itchy bug bite. And how does it work? Hydrocortisone works by decreasing your body's immune response, which in turn reduces redness, swelling, and itching. It's like telling your body's overenthusiastic defense system to chill out. Using it is simple, but there are things to keep in mind. Always start with clean, dry skin. Apply a thin layer to the affected area, usually 1 to 4 times a day as directed by your doctor. Remember, with this type of medicine, more is not always better. But let's talk about side effects. While generally safe, hydrocortisone cream can cause skin thinning, discoloration, or worsening of untreated infections. So, always use it as prescribed and consult your doctor if anything feels off. And here's an important heads up. If you are pregnant, breastfeeding, or have a skin infection, it's crucial to check with your doctor before using. Safety first, right? To sum it up, hydrocortisone cream is a helpful tool in your skincare arsenal, but respect its power. Use it wisely, follow the guidelines, and when in doubt, talk to your doctor. Thanks for watching, and take care of your skin and yourself.
If you've made it this far, let us know in the comments why you're using this medicine.